We have a woman we love. Yes, she's one of the finest Nigerian physicians in the United Kingdom and an MD CEO of Marcelle Ruth Cancer Centre in Lagos. She's back now in the country with a wealth of resources and experience to assist in the nation's ailing health sector. Welcome with us, Dr. Elebute-Odunsi. Sorry for our initial ranting on taxation. How are you doing, madam?
I'm very well. Good morning. I was enjoying the the raucous conversation about taxes. Yes, I was.
I know. So let's even start with that, because you live in the UK for many years, and I mean we hear about the percentage of taxes you pay, and there's always this distrust among citizens and the government, especially in Nigeria, on paying taxes. In your view, how do we get Nigerians to begin to believe that the government will work for them when they pay taxes?
Oh, I mean, honestly, I think it's a tricky question, but I mean, listening to the ladies on the show and all the work that they're doing, I think at the end of the day, I think what everybody's trying to say is if we pay taxes, then we expect to have the support, the system, you know, the electricity, the water, and everything that we expect to have if we pay taxes. You don't want to be paying taxes and then have to go and buy your own generator and get your own water and put in your own security. So I think things are changing.
Right.
I think generally things are changing in the country, and it will take a while, and we have to, like you said, we've just got to put our trust, and we've got to all pull together to try and make these things work.
Okay, great. Now let's talk about cancer now. You've done quite a bit of work in this sector. What are your thoughts on cancer information in Nigeria? The fact that we hear a lot of people talking about it, but a lot is still yet to be done concerning people getting tested on time. What have you done so far to get that sensitization out there?
So, as you said, I've been in the UK for over 30 years and just come back recently to open what is a comprehensive specialist centre, both for cancer and other conditions, really. And again, to be honest, from my point of view, having been back for almost a year now, there's a lot happening in the healthcare system in Nigeria, a lot in the private sector in particular, and some in the public sector as well. So there's the Cancer Centre at Louth that was partly funded as a PPP with the NSIA. There are a number of places where the cancer centres being planned. Definitely, it's generated a lot of conversation about cancer. There are quite a number of NGOs that I've come across as well who are doing exceptional work across the country, particularly in female cancers, because most of them are obviously run by women. But yes, for me, there is hope. There's a lot going on. Now, what are we doing? We've set up a one-stop shop, a hospital in which patients can come in an environment that they would want to be in. That's the first thing that was important to me. We've also been very careful and paid a lot of attention to the patient journey, so that when patients come, they're well attended to quite promptly with compassion. We've done a lot to make sure that patients will get information, which is what I think you're also talking about. And that, I feel, has been lacking in the country. Most places don't seem to have information booklets to give patients, so that has to change. But in general, I think for me, the biggest issue is that we've got to put a lot of work into screening, into making sure that people understand that unless you go for a regular annual checkup, a comprehensive checkup once a year, particularly once you're above 40, because that's when the risks of certain cancers are higher. If you don't go for these screening checks, then you're not likely to pick up, cancer if it's happening and if it's silent in your body. A bit like blood pressure, sometimes hypertension can be, people can be hypertensive for quite a while before they know. So screening is a big issue, and it's something that we're going to put a lot of effort in, because we really need to change the narrative. The biggest problems that we have now is that the majority of the patients that we see are presenting in late stages of cancer, where even when we now have the treatments, we can't make any impact on what they have already because it's spread all around their body, and basically you're just sort of keeping them comfortable, which is not the way we want to be or where we want to be.
All right, let me go on a
So that's what we're trying to do.
Let me go on a quick break. When we come back, we'll continue this conversation with you. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. So we still have with us Dr. Elebute-Odunsi. Mariam had a question. Go ahead, please.
Okay, so Doctor, given the many years that you've spent abroad and your experience, I always like to just, pick the brains of people like that, because you come with this experience to our Nigerian situation and our Nigerian story. And the Nigerian narrative concerning cancer is, you hear all the time, it's not that we don't want to go for screening, it's not like we do not want to get to the hospitals on time, but it costs so much. And there's hardly any government, help or intervention with the fee, with the hospital bills and things like that. And from what we hear abroad, people are on some health care plan, and it covers for some cancers as well. What do you think you can bring to Nigeria now that you're here? What would be the advice to Nigerians, one, and also the government in helping, solve this particular issue?
That's a very good question. Now, in the UK or the US, it's not because people are on a healthcare plan that's paid for by the government. What it is that they have access to usually free healthcare by going to their local hospital to have tests. Also, in those countries, people get notification in their mail or to say, look, you're now 40, you need to have a mammogram, or you're 20-something, you should go and have your human papillovirus vaccine. So they get a notification from the healthcare service. It's not that they have healthcare plans, but obviously a lot of the care is freely accessible, if you see what I'm trying to say. Now, people who also want to access care more quicker have insurance that allows them to have these comprehensive checkups that you're talking about. And that some of that is happening here. There are insurance companies that are providing policies for people to have. And also, I know that Lagos State government, for example, has set up an insurance policy for people to be able to access care. So there is, yes, I agree. It's not enough. There's a lot that needs to be done, that's for sure. And also, healthcare in Nigeria remains quite expensive. Like a lot of things in Nigeria are expensive for a number of reasons. And I'm not a politician, so I don't want to go down that road. But I do feel that every individual owes it to themselves. Yes, we can blame government for everything, or we can, but what matters really is how important is your health to you, and how important is it for you to ensure that you remain well, and that if you have a problem, that you access care quickly. One thing I will tell you is that there is a high number of cancers in this country. Make no mistake about it. It's not something that's rare. I'm seeing more and more every day in my clinic, young patients in particular, in their 30s and their 40s, who have cancers that have spread quite widely, and where we're sitting in frustration because we can't do anything. So this is a real problem. Like COVID is a real problem. And I think every individual owes it to themselves to inquire about policies that they can, HMO plans.
Let me get a few more questions. Let me get a few more questions in for you. Go ahead, Lucy.
Okay, Ma. So I know that there are scientific breakthroughs that had to do with using local herbs to cure cancer, or to, help manage the disease, cancer, and so one of those is the cannabis. And we know that it's illegal in Nigeria, so to speak. But are you looking at, finding a way that you can incorporate that in the treatment of cancer, which may likely even be cheaper for the cancer patients in Nigeria, against just going through the chemo and all of that? That's something you have plans to look into for Nigeria?
The short answer to that is no. and that's not just because it's Nigeria. I think that when you look at the stories behind or the information about CBD, cannabis oil, which I think is what you're referring to, which is supposed to be something that cures not just cancer, but anything and everything, right? And as you said when you introduced me, I am a medical doctor, I am a scientist, I've done a lot of research, and so a lot of the work that we base what we're doing on is based on research that has been done on several populations, comparing normal with the treatments that we're offering, and that's where we are at. No, I don't have any experience in using cannabis for curing cancer or any other condition, and I think I'd be one needs to be careful of something that's supposed to be able to cure anything and everything. What is for sure is that, yes, chemotherapy may be toxic in a way, but actually there's a lot of work that's been done in the pharmaceutical industry so that a lot of the treatments we're using now are very targeted towards what we're treating.
Right.
Most of them are called monoclonal antibodies, and they have less side effects on the rest of the body and more effect on the cancer that we're trying to treat. So we have more skills together as a group to make sure that we're providing the best care that is well researched and well shown with data to back it up, that they're effective, but also trying to do it in a way that they're less toxic to the people we're giving it to. The other thing we do is that we treat our patients together in a multidisciplinary team. We're working together, doctors, nurses, pharmacists, radiotherapists. In our center, we're working with doctors here, and because Zoom has done a lot in terms of making sure that communication is better like we're doing today. So we also have on our tumor board once a week specialists from the US, from the UK. So we're working with guidelines. We're bringing international standards of care here in Lagos, in Nigeria, so that patients don't have to get on a plane and go to the UK, South Africa, India, dislocate themselves from their family at a time when they're dealing with a very serious condition.
Right.
They can now be treated here with the trust, because I think that's one of the issues that you're discussing, whether it be tax or healthcare or education, is that we need to bring back trust in this country, in all the things that we're doing.
Okay.
And myself and a number of other people have made the sacrifice to come back to impact healthcare, as some people are doing in education and other fields, and hopefully bring back the trust that patients will have, but to do it in the right way with
we have to wrap
that
up.
we know well.
All right, go ahead. Let me get a final question.
You have a wealth and even the history of growing up in the medical field. Would you, with what you said earlier about cancer being more prevalent than we would admit in the country now, would you not suggest that we expand what our basic health coverage is for health insurance companies and even the Lagos State Health Insurance, expand our basic health coverage to cover cancers and some other major illnesses because of the prevalence of it now in the society?
I totally agree with you. I totally agree with you. And I will say that I know that, we had the Commissioner of Health for Lagos State come and visit us the other day. And I know also that a lot of HMOs and the policymakers are working very hard to make sure that we are able to provide this care to more people. The other thing is, we are setting up a foundation. We've already set up a foundation, as have quite a number of people. So there are a number of ways that people can access care. I know it's not enough. I know there's more that needs to be done. But, in my own small way, I'm back and I'm doing my best in our setting to try and make sure that we provide the best care that we can in the right way, and also providing the right information, making sure that we provide, screening and timely treatments to not just the patients, but also the families who need the support at the same time. I mean, honestly, you think about young women with breast cancer who have young children, and in the past they had no other choice but to get on a plane to go abroad. Now we can treat them here, and they can be at home with their families.
All right,
that's what we're trying to achieve.
Thank you so much,
Thank
Dr.
you, ma'am.
Elebute-Odunsi. We appreciate you being here.
And thank you very much for having me. Thank you. Really enjoyed the conversation. Thank you very much.
That's all we can take on the show now. Hope you learned a lot as much as we did. Pay your taxes. We're going to deal with this matter
Provide
properly.
your amenities.
Have a fabulous day. We'll see you tomorrow. Bye for now.